for sure. I mean, that's a real tangible way where you could see somebody, when they have that financial incentive, changing their choices. I think for me and some of the patient experiences that I've seen, it's kind of hard because, I know you're going into family medicine and then I applied anesthesia. So, inside and outside of the operating room, there's not a lot of talk about that. It's more talk about, when was the last time you ate food? I think it doesn't get brought up much, but I think it does get brought up just in conversations around the general healthcare of society. I did some rotations when I was in New Orleans. I was asking about kind of the access to care, access to transplants, etc. And they were all talked about, like, hey, there's really bad insecurity throughout here. There's bad food insecurity, and it plays into patient outcomes. So I looked into one research article, and there's one article that kind of talks about patients with cardiac surgery, and they found that patients who came from areas that were food insecure had worse outcomes in terms of 90-day mortality, extended hospital length of stay, compared to people from food secure areas. So you can see how much of an impact this is going to have, not only in some of the outpatient settings like you're more accustomed to, but also in the inpatient settings when you're thinking about an increased length of stay, changing your mortality rates, etc. I think it's something that's really important to address because of kind of the holistic aspects extend into places where you normally wouldn't expect it. Like going in for, a mitral valve replacement or something like that, or an aortic valve replacement. So,
I think that's very true. Like, it's not just something that our patients experience outside the hospital, but it's something that's very clearly driving outcomes that happen even in settings you wouldn't expect, like the OR, like you mentioned.